Welcome back. Today we are going to check the different techniques and we are going to define those techniques so we can learn in English what we are doing in our daily jobs. So I'm going to read the definitions for you, and your job consists on translating. You can search for certain words in Google Translator, or you can copy. You have a Word document in which you have the definitions, and you can copy and paste into Google Translator and check what does that mean in Spanish. Okay, so that's your job, and let's get started. These techniques are for physical therapy, and the first one is exercise therapy. It's a type of rehabilitation that uses physical activity to help treat injuries or conditions. It can be used independently or with other treatments like medication or surgery. Stretching is a physical exercise that requires putting a body part in a certain position that will serve in the lengthening and elongation of the muscle or muscle group, and thus enhance its flexibility and elasticity. Strength training are exercises which are designed to increase the strength of specific muscle or groups of muscles. Strengthening exercises overload the muscle until the point of muscle fatigue. This force and overload of a muscle encourages the growth, increasing the strength. Electrotherapy. It's a treatment that focuses on the application of external forms of energy, either sound, light, or electricity. These forms of energy, when applied at safe low doses, can cause a change in your cells and tissue that is advantageous to healing. Manual therapy is a passive skilled movement applied by clinicians that directly or indirectly targets a variety of anatomical structures or systems, which is utilized with the intent to create beneficial changes in some aspects of the patient pain experience. Heat or cold therapy. As a rule of thumb, use cold therapy in the early management of any acute injury where signs of inflammation, swelling, increased tissue temperature are present. Use heat therapy for muscle pain or stiffness. Traction. Traction is a manual technique designed to reduce pressure on affected vertebral discs that are causing pain. Traction is a manual stretching of the spine, which reduces pressure on the discs and therefore reduces the individual's pain. Ultrasound. Ultrasound can help relax tight muscles that are sore and warms muscles and soft tissues, which increases circulation that helps healing. TENS, transcutaneous electrical nerve stimulation, is a method of electrical stimulation which primarily aims to provide a degree of symptomatic pain relief by exciting sensory nerves and thereby stimulating either the pain gate mechanism and/or the opioid system. And finally, dry needling. Trigger point dry needling is an invasive procedure where a fine needle or acupuncture needle is inserted into the skin and muscle. It is aimed at myofascial trigger points, which are hyperirritable spots in skeletal muscle that are associated with a hypersensitive palpable nodule in a taut band. trigger point dry needling can be carried out at a superficial or deep tissue level. All right, that's all for today's video. See you in the next one.